Well, good morning, hello and welcome to Wednesday's Weekly. This is your bite-sized briefing webinar, a collaboration between Action Together, the voluntary community and faith sector and the public sector. It's my pleasure to welcome you to this episode of our Cost of Living Crisis Series. Action Together are working with Oldham Council to welcome you every Wednesday between now and April to hear from the services and organisations that are working alongside you in Oldham, delivering critical help to support Oldham's residents through the cost of living crisis. So without further ado, I'm really pleased to hand you over to Suzy Pabla from Ancora, who will be taking us from here. Over to you, Suzy.
Hi, everyone. So yes, I'm just here to talk about Ancora. I'm not sure if people have heard of us or not. So that's our logo. We're a partnership. Sorry, I'm going to just move the camera out of the way because it's covering my screen. So yeah, we're a partnership that was formed in 2016. So I've worked for Keyring for just short of 20 years. I managed a service called the Intensive Service, which is a service that we provided to vulnerable adults that either were or were not Care Act eligible. We worked with them for up to 12 months, maybe a little bit longer, maybe a little bit less. So I used to go out and do the assessments, and when I went out, because we only had a limited resource of places, because it was a commissioned service, I'd go out and do assessments and put people on our waiting list, knowing full well that I couldn't work with them for a few months, kind of thing. And then depending on how busy I was and what the situation was, I'd get myself involved in doing little bits of things for the people that were on the waiting list, because I knew that if I, for example, helped them ring up for a PIP form and filled it in, at least that was in the pipeline. Or if I made sure that they were registered with a GP or their medication wasn't, I'd do little bits, even though we couldn't possibly take them on as full Keyring members yet, because we didn't have a vacancy. And I think as time went on and funding cuts, unfortunately, from Oldham Council for the commission service, that started to happen more and more. And I used to talk to my manager and say, I'm just doing this with this person, and I'm just doing that with that person, but they're on our waiting list. And then just bizarrely, the big lottery advertised some funding, which was Help Through Crisis, and we applied, and that's where we're at, really. So the project is a collaboration between Christians Against Poverty and Oldham Food Bank. Both, as I'm sure you're aware, have services in Oldham, even though they're bigger. They're a part of a bigger sort of national service, such as Old Food Bank is obviously partnered with the Trussell Trust, and Christians Against Poverty, their main office is in Bradford. So the idea is to support people to address poverty in Oldham. Sometimes that is just a light touch kind of involvement where, for whatever reason, someone needs a food voucher, or they need support to buy a cooker because it stopped working, but usually they're okay. So sometimes it can be very light touch and be involved in very specific one-off issues. And then at other times there can be more issues that, as you delve, sort of things become more apparent, really. So Laura, can I have the next slide? So these are just figures. So our contract, as it stands at the moment, runs from the 1st of December to the 30th of November. So these figures relate to that period. What I haven't updated on here is that we worked with 1,403 individuals, different individuals, unique individuals, in the last 12 months. Whereas in 2016, we were working with about 450. And even just 2 years ago, just at the start of COVID, we were sort of hitting the 700, 750 mark. So it's a huge rise in the number of people that are coming to us. At the moment, we're a really small team of 4 people, and we all work part-time. Currently, I've got some funding for 2 part-time workers up until the end of March. And then after that, unfortunately, so I'm always scrabbling around for money, mainly for staffing costs, because yes, we offer a 5-day service with 4 part-time staff, and with the numbers going up, it's really important that we try and address as much as we can and protect us as a staff team as well. So with that in mind, some of these figures are unlikely to be accurate, really. So because it's all to do with our recording system. So I think that we probably helped a lot more than 14 people move away from rough sleeping, but that's what the statistics are saying to me off the system that we use, really. But we know that we're working really hard, and we're doing we're really busy at the moment. Unfortunately, I was just saying to Laura before that I've had 2 staff off recently because they both got COVID and were quite poorly with it. They're both back in today, so that's a huge relief, really. So yeah, okay, Laura, next. So I just thought I'd tell you a little bit about what we do. So this is Peter. So Peter was a gentleman that was married. Him and his wife lived alone in First Choice Homes property. His wife had multiple health issues, and I think DWP referred Peter to us, and basically he was absolutely desperate. His wife has I can't remember what it is, sorry, I'm looking for my notes, but a CPAP machine, as well as lots of other things, which is obviously reliant on electricity, and they had run out of electricity completely. They were a very proud couple, and basically he'd even pawned his phone for money to put electric on his meter. So but then that had run out, and then he wasn't due his benefits for another week. So we actually physically went out and met Peter. That's not his real name, by the way. And basically we put some emergency credit on his electricity straight away, and then arranged to meet him the next day. The next day, we paid for his phone to come out of the pawn shop, so that he wasn't in this continued cycle of having to pawn it and then paying more to get his phone back. And then we did a few other little things, like we supported the couple to get some funding for a washing machine. And basically that was enough to start him on the journey to get things moving a little bit better. His wife had a PIP form that was in, and they were just waiting for an assessment. They had a really good relationship with their GP, who was supporting them, and basically that's the kind of thing that we do, really. So he sent us a comment afterwards and put, "Hi to all you lovely people. Thank you for all your help and support you've given me and my wife." And then he's put, "We had no electricity and no smartphone to get a voucher, so there was absolutely no one that could help us. Ancora met us, topped up our electric, without which my wife's CPAP's machine, which she needs to breathe at night, would not work. We also had no hot food or lights. We were so touched by your kindness and understanding of our situation. Ancora also helped us by getting my phone out of the pawn shop to help break the cycle and to help us to get a washing machine. Thank you very much from the bottom of our hearts." And I suppose the only thing that I suppose I will say about Ancora is that we will always try our very best to do what we can with limited resources. And I know that lots of agencies do the same. But these often are people that we've had no relationship with whatsoever until that initial phone call. So yeah, Laura, can you go to the next slide? So this case study is sort of self-explanatory. A lady had fled domestic violence. She was in temporary accommodation. She basically had very little. Her support network had broken down because she'd been placed in Oldham from out of borough. And we supported her to contact her local councillor from the area that she was from, who did their best really and managed to get things moving. But in the meantime, she was supporting her children to attend school still at their old school, which was a number of miles away, and we supported the family with some bus tickets and all that kind of thing, and then supported her to access some furniture for when she moved. So that's that one really. Next one, sorry. Right, so besides Ancora and the crisis support that we offer, we also support people to complete money management and life skills course with us. So that's part of the CAP partnership that we're in. So Lisa with the I can't remember what it's called now, face mask on, is our CAP Ancora worker. So she leads on those courses. So she is sort of supervised by both me and Christians Against Poverty, and all the resources that she uses at the life skills and money management skills are provided by life skills by Christians Against Poverty, and any updates to the courses and things like that are sort of done via that, even though Lisa is a Keyring employee. So they're just a few figures, that 74 people attended the courses in the last 12 months. 9 people have started volunteering. 2 people have actually started volunteering at Life Skills and are now peer mentors, and 5 people have moved into paid employment. So sometimes people attend our Life Skills because we've sort of encouraged them to in our conversations when they've contacted Ancora, and some other people are just referred in because anyone can access the courses. We try and run at least 4 life skill courses a year. Each one of them is 8 weeks. The money management courses are only 1 day, and we try and get people to invite us and provide us with a room and refreshments, and then we will put the training on for free. So yeah, and there's how you can contact us. We've got our own webpage, so I'm tasked to update it, so unfortunately I only update it when I get time and if my skills allow, but people do contact us through Facebook. They ring us at the moment because we were quite short-staffed. The phone number is a messaging service, so people ring the number, leave a message with their details, and we ring them back. Or they can email us directly. We try our very, very best to contact people within 24 hours, and I'm pretty sure we usually meet that target. There might be the odd person that we don't for whatever reason, but generally we will make contact. Whether that person responds to our email or responds to our call is a slightly different matter, but yeah, that's where we are, and we're always looking for funding and donations and all that kind of thing. We've got a healthy amount of money from the Household Support Fund in this last round of funds. So we've been supporting people with providing them with beds. We've done some carpet, we've done some white goods, supermarket vouchers. We will always try and link them with support that they're involved with themselves already, and have that conversation with that support provider as well as us, because basically, you know, that they know their clients a lot better than we do. And even for food parcels, really, we'd be sort of saying to people, you know, oh, why has your worker referred you to Ancora when they can provide you for a food parcel or complete the warm homes referral and things like that. So that's the end of it, really. So I don't know if anyone's got any questions.